So what I want to do to you with today is to start looking at the role of attachment and trauma to personality disorders. One of the problems that we found is that personality disorders have usually been, formulated as disturbances in the personality, and there have been very clear symptoms that would need to be present in order to make that diagnosis. But etiologically, in terms of why people might have that personality disorder, in my view, I think the etiology has not been as comprehensive as it might be.